Imagine you are at your annual health checkup, feeling good and proactive about your well-being. Your doctor mentions something called human papillomavirus, or HPV, and you might wonder exactly what that means and why it is important for your health. What exactly is this virus? Well, human papillomavirus, commonly known as HPV, is a very common viral infection that can affect both men and women. It is primarily known for causing almost all cases of cervical cancer, but it is also linked to other cancers like those of the anus, throat, and genitals. Its widespread nature makes understanding it a crucial part of proactive health management. HPV is actually a group of more than 200 related viruses, and many of these types are incredibly common and often harmless. The virus spreads through skin-to-skin contact, most frequently during sexual activity, including vaginal, anal, or oral sex. It is so common that nearly 80% of sexually active people will get at least one type of HPV at some point in their lives. Most people who become infected with HPV do not even know they have it because their immune system clears the virus naturally, often within 1 or 2 years, without causing any symptoms. However, certain types of HPV are considered high risk because they can cause abnormal changes in cells that, if left untreated, may lead to cancer over many years. Other types are considered low risk and can cause conditions like genital warts, which are typically benign growths and not cancerous. It is important to remember that HPV is incredibly common, and having it does not mean you have cancer or will develop it. Instead, it means you should be aware of the importance of screening and prevention, and proactive steps you can take. The good news is that there are clear and effective steps you can take to protect yourself and manage HPV. The most effective way to prevent infection with the high-risk HPV types that cause cancer is through vaccination. The HPV vaccine is highly effective and safe, and it is recommended for young people, ideally before they are exposed to the virus. For those who are sexually active, using condoms consistently and correctly can also help reduce the risk of HPV transmission, although they do not offer complete protection because the virus can infect areas not covered by a condom. Regular screenings, such as Pap tests for women, are also crucial. These tests can detect abnormal cell changes in the cervix caused by high-risk HPV early on, allowing for timely monitoring or treatment before cancer has a chance to develop. Understanding the difference between high-risk and low-risk HPV types is a key insight. High-risk types, such as HPV-16 and HPV-18, are responsible for about 70% of all HPV-related cancers, making their prevention and early detection particularly important. On the other hand, low-risk types, such as HPV-6 and HPV-11, typically cause genital warts. These warts are benign, meaning they are not cancerous and do not turn into cancer. When a Pap test shows abnormal cells, healthcare providers often refer to this as dysplasia, which simply means there are abnormal cells on the surface of the cervix. Detecting and treating dysplasia early is a powerful preventative measure, as it can effectively stop cancer before it even starts. This proactive approach highlights the immense value of regular health screenings and preventative care. In conclusion, human papillomavirus is a widespread virus with a vast array of types, and for the majority of people, their immune system successfully clears it. For the specific high-risk types that can potentially lead to cancer, effective prevention through vaccination and early detection through regular screenings are your most powerful tools. By staying informed, understanding your risks, and taking these simple, proactive health steps, you are actively protecting your well-being and significantly reducing your risk of HPV-related complications. Remember, this information is for educational purposes only and is not medical advice. Always consult your healthcare provider for personalized guidance.